name is Brandon Holman, and this is Radiation Safety Training, provided by Corwin Health Physics. This radiation safety training is intended for those that work in nuclear medicine, as most of the content is geared towards safety around radioactive material and common processes for the nuclear medicine technologists. We will briefly touch on why you need this training, and then focus on general safety items that are important around the nuke med department. We will spend a little bit of time reviewing exposure limits, dosimetry, and the ALARA program, but mainly focus on the processes that create a safety culture in your department. Let's get started. Throughout this presentation, you will hear me refer to the DOH or NRC, sometimes in reference to you contacting one of these departments. If you are located in Washington, your licensing authority is the Washington Department of Health. If you are in Oregon, your licensing authority is the Oregon Health Authority. And if you are a state licensed by the NRC, you would report to the Nuclear Regulatory Commission. Each of your licensing departments will have a copy of your radioactive material license. However, you should have a copy of your radioactive material license in your nuke med department. If it is not there, your RSO should have a copy. Also, a copy of applicable regulations should be kept in the department. However, these can easily be found and are accessible online. Although there are state and federal requirements for annual radiation safety training in certain modalities, this training is more than just an obligation. This training reminds radiation workers of the risks that are related to their job. Having these annual reminders not only helps you reduce your exposure by applying basic principles, but it also gives you the basic knowledge of ionizing radiation, and to hopefully help you answer some common radiation questions from friends and family, and most importantly, patients. There are several items that should be considered around the nuclear medicine department that will not only help you perform your job well, but limit accidents, prevent spread of contamination, and comply with state and federal regulations. To begin with, when working with radioactive material, lab coats or other protective clothing must be worn. Disposable gloves shall be worn at all times when handling radioactive material. These gloves should be changed frequently so as to avoid cross-contamination with other surfaces in the laboratory. Be sure to remove your gloves whenever handling anything non-radioactive. It is important to monitor your hands and clothing with a survey meter when leaving the laboratory. Lab coats and gloves that could be contaminated should never be worn outside the lab. If you discover that your hands are contaminated, reduce the level of contamination by washing with soap and water. Notify your supervisor immediately if contamination requires evacuation or restricted entry to the area. Do not eat, drink, smoke, apply cosmetics, or place anything in the mouth in any area where radioactive material is used or stored. No food or drink is to be stored in any radioactive material area. Although this is not a likely occurrence, we like to remind techs that mouth pipetting of any substance is never to be performed in a radioactive material area. Pipetting devices should not be utilized. Be sure that your radioactive materials, such as sealed sources or radiopharmaceuticals, are stored in a secured room to prevent unauthorized access. If utilizing a dose calibrator, assay each dose in accordance with the manufacturer's instruction manual. Read labels carefully before injecting. After injection, assay empty syringe in the dose calibrator to determine actual administered amount. Record this data into the hot lab computer. Appropriate vial and syringe shields must be used when preparing radiopharmaceuticals. Most sites have syringe shields, and their use is strongly recommended while injecting. Be sure that radioactive material is stored and transported in the appropriate, usually provided, shielded and labeled containers. The transportation of radioactive materials must be in accordance with the Department of Health and U.S. Department of Transportation. Ensure that incoming and outgoing packages are not contaminated by performing a wipe test. If contamination involves injuries or open wounds, follow emergency procedures and notify the RSO at once. Ensure that dosimetry badges are worn at all times when working with radioactive materials. It is especially important that your finger dosimeters, sometimes called TCD rings, are to be worn when preparing or injecting radiopharmaceuticals. Dosimetry is one of those items that are required for all individuals who are considered radiation workers, as well as any individual who will work in a fluoroscopy room during use of the system. There used to be an exception to this rule. However, they no longer apply. As a nuclear medicine technologist, you'll be issued and be required to wear a whole body badge and a ring badge. Ensure that the body badge is worn near the collar area and that the ring dosimeter is on your dominant hand, the hand that will most likely be handling radioactive material. The ring dosimeter does not need to be worn at all times, only when handling radioactive material. If you moonlight, meaning if you also work as an occupational radiation worker at another facility, ensure your supervisor is notified. The dose you receive from both sites will need to be combined. Your annual dose limit is focused on the individual and not per facility. As you go, so does your dose. Also, to ensure your badge reading is accurate, store badges in a low radiation area. All individuals with dosimetry should receive annually, or have access to, your dosimetry records. If you exceed 30% of your annual limit, also known as Investigational Level 2, you should receive a letter from your RSO reminding you how to keep doses ALARA. Here is a list of annual limits in millirem and millisieverts. You can see that the annual limit for an occupational rad worker is much more than those considered the general public. However, both limits are considered well below any non-stochastic limits. Notice also that our skin and eyes are given a larger dose limit. The eye limit, however, may be changing in the future as new research shows that cataracts may form with lower doses than previously documented. Also note that the average individual receives roughly 360 millirem per year from background radiation. Occupational rad workers who declare pregnancy are given a lower dose limit of 500 millirem during the gestation period, as you probably saw in the previous slide. This limit is only binding if the individual declares pregnancy and it is in writing. The declaration is up to the individual and cannot be forced. Also, duties are not automatically changed when the pregnancy is declared. It is up to the facility, as long as they can keep doses under 50 millirem per month during pregnancy. Now let's discuss ALARA. All sites that utilize ionizing radiation must maintain a radiation safety program to keep doses as low as reasonably achievable. ALARA. This program is more than just reviewing dosimetry. It is all aspects that create a safe and sufficient environment for patients, the public, and workers around ionizing radiation. Dosimetry is just one of the many tools used to keep doses ALARA, utilizing a method that looks at 2 investigational levels per quarter that are reviewed and documented throughout the year. Other ALARA principles that are used to reduce exposure consider time, distance, and shielding. For nuclear medicine technologists and individuals around fluoroscopy, reducing your time around the radiation, increasing your distance from the radiation, and having increased shielding, where applicable and reasonable, will keep doses ALARA. Here's a diagram that shows different materials and the penetration power of different types of ionizing radiation. Gammas, X-rays, and betas are what we typically work with in nuclear medicine. Concrete and lead should be familiar material around the department. Please note, however, that lead is not considered a great attenuator for beta radiation, as this high Z material will usually produce bremsstrahlung when bombarded with betas. Here is a list of important processes that are usually performed daily in your department in order to maintain a smooth, efficient, and safe environment. Daily dose calibrator constancy checks are important to ensure your dose calibrator is operating correctly. This should be performed at the beginning of the day, and each channel that is used diagnostically should be checked. When you receive a package, ensure that the proper surveys are performed, a survey at the surface of the package and 1 meter, and that the package is wiped and the wipe analyzed for surface contamination. Ensure doses waiting to be administered are checked prior to injection. Doses should be within 20% of the prescribed amount for diagnostic work. If it is a therapy administration, it is preferred to be within 10% of the prescribed amount. Daily surveys are often missed as they are performed at the end of the day. Ensure all locations where unsealed radioactive material is used have a survey. Also ensure survey meters are checked daily, which usually means checking the batteries and checking the response of the meter with the check source. When returning a package, the The same steps should be taken when receiving a package. A survey at the surface and 1 meter should be performed to ensure they are below regulatory limits, and a wipe of the package should be completed and analyzed for removable contamination. Wipes are often missed for outgoing packages. Quarterly, sealed sources are inventoried at your site. However, these sources, along with the received radiopharmaceuticals, should be checked and kept in secure locations, usually the hot lab, at all times. The hot lab space must also remain secure and only required personnel should have access. Ensure that storage and use of radioactive material are kept in authorized locations. And also, if your site disposes of radioactive material, ensure that it is disposed of properly as specified in your license. Sources that are not licensed for disposal must be properly returned back to the manufacturer. Waste logs are difficult to maintain, but are an important aspect of your job. Waste should be separated into long-term and short-term waste bins and be tracked either on paper or tracking software. The bins should be numbered and match your inventory. When these bins have decayed below background, ensure a survey is performed. Remove any radiation labels before disposal into normal trash. Please ensure the waste log is maintained. Weekly wipes are no longer required by the Washington DOH. As long as you are consistently performing your daily surveys, weekly wipes do not need to be performed. However, facilities in Oregon or sites regulated by the NRC usually require weekly wipes, but this usually depends on licensing conditions. Please ensure you are following what is specified in your RAM license. Let's discuss medical events. Now, medical events are not to be taken lightly, as it involves the NRC or your Department of Health. But there are some things you should understand to determine a medical event, and your RSO should be consulted prior to reporting to the Department of Health or NRC. Let me explain. There are instances where two things must occur in order for it to be considered a medical event. First, look at if the dose differs from the prescribed dose by one of these conditions, here listed in the first condition category. If the dose differs from the prescribed dose by one of these conditions, the second thing that must occur for this to be a medical event is one of the following listed here in the second condition category. In any case, or if any of the following occur that is shown on this slide, your RSO should be contacted to determine if a medical event may have occurred. Now, a dose that does exceed 5 rem effective dose equivalent, or 50 rem to an organ, or 50 rem to the skin by one of these following conditions, this would be considered a medical event. However, it is always important to consult with your RSO, who can even consult with us prior to contacting the DOH or NRC, just to make sure a medical event did indeed occur. However, these events are time sensitive. The DOH or NRC must be contacted within 1 day after discovery of the event, and a written report within 15 days after discovery of the event. Now, there are times where you may have patients that are either pregnant and or nursing and you are unaware. This is why steps should be taken to set up a process in order to not unintentionally administer radiopharmaceuticals to a pregnant or breastfeeding individual. However, accidents can occur. If such an individual is administered radioactive material, and one of these limits is exceeded shown on this slide, notify the DOH or NRC and your RSO. In cases of lost or stolen radioactive material, or you are certain you or a colleague has been overexposed, you should contact your RSO right away, who should contact the Washington Department of Health, the Oregon Health Authority, or the NRC emergency line. The Washington Department of Health has a paper-sized poster pictured on this slide, and it can be easily found online. Other states should have something similar and should be posted in your department in an area easily accessible and visible. Although they don't happen very often, your department should have cleanup procedures for either a major or minor spill. Depending on the activity of your radiopharmaceuticals, you may not even see a major spill. Here's a chart showing what would be considered a major spill if activities of these radionuclides were spilled. Spills below the activity listed would be considered a minor spill. For major spills, the main thing is clearing and isolating the area. Once you have stopped the spread of the spill, usually with chucks, ensure you inform others that work in the department and call for help if you need it. Ensure that a survey is performed after the cleanup and proper shields are used. Inform the RSO of the incident and also make sure it is documented. The area should be clearly labeled and monitored daily until below background. For minor spills, there are some similarities. The spill should be stopped and isolated, but the spill may be easily cleaned up with soap and water or a decontamination agent. Others should be warned and the area clearly labeled if any residual activity remains. Ensure that a survey is performed and the incident reported. Most minor spills, such as Tech 99M, are below background in a few days. Here's a quick reminder on waste disposal. Some radioactive material you will return to the manufacturer. An example of this is a sealed source with low activity. Others you can decay in-house and keep a waste log. The information that should be included on the log is date the bin was logged or opened, date the bin was disposed or closed, what instrument was used when it was surveyed, the survey measurement, and background levels during the measurement. It might also be a good idea to have an area for additional notes. An important aspect for keeping track of waste is labeling bins, usually with numbers, and having them match what is recorded in your inventory. Long-term and short-term waste should be separate, and the inventory, either on paper or hot lab tracking software, should be reviewed and updated often. These last few slides are just some quick reminders. Ionizing radiation is not just in the medical field, but comes from many different sources, including our own bodies. Although care should be taken in keeping our doses of ALARA while working in our department or working with patients, it is good to have a general understanding that ionizing radiation is part of our everyday lives. This chart gives us a good overview of the major contributors of ionizing radiation from various sources. The medical field makes up several slices of the pie chart. However, the largest slice comes from radon and thoron, and that is background radiation. If you remember, the average individual receives roughly 360 mg per year from background radiation. Now, if we just look at the medical field, computed tomography continues to be utilized the most due to its ability to combine a series of X-ray images and create cross-sectional images of the bones, soft tissue, and even blood vessels. It takes the cake, or in this case, the largest slice of the pie. As you can see, nuclear medicine is the next largest slice, being just under a fourth of medical exposure to patients if you look at all contributing modalities. Because we have an understanding of the risks involved with ionizing radiation, each radiation department must have this document, Notice to Employees. In Washington, this form is referred to as the RHF-3 form. In Oregon, it's the Oregon Health Authority Form 3. And for the NRC, NRC Form 3. These documents must be posted in an area easily visible in their respective departments and can be easily found online. They are important because it reminds occupational rad workers of their rights and responsibilities and also gives some brief information on the Washington DOH, Oregon Health Authority, or the NRC's involvement. Remember, you are a critical element of the radiation safety program. You have an obligation to report unsafe conditions to the radiation safety officer. Know who your radiation safety officer is and how to contact them. Additionally, you may reach out to your state or NRC with concerns. Thank you for allowing me to provide you with this radiation safety training. Here is a brief overview of what was covered. If you have questions or concerns about what was covered in this presentation, please let us know. We can be contacted by emailing us at info@corwinhp.com, or you can check us out online at www.corwinhp.com, and you can send us a message through our Contact tab. If you visit us online, you will see that Corwin Health Physics provides comprehensive medical physics services for all imaging modalities throughout the Pacific Northwest. We can assist you in evaluating all of the following and more. Contact us for more information. Thank you.